Good day, I'm Deypalan from BSN3-Leininger, and today I will going to assess vital signs. It includes temperature, pulse rate, respiratory rate, and blood pressure. Wash your hands. Hand washing prevents the spread of infection. Prepare all required equipments. Organization facilitates accurate skill performance. Explain the purpose and the procedure to the client, providing information fosters cooperation and understanding. Close the door to maintain client's privacy and minimize embarrassment. Clean the thermometer with rubbing alcohol before first use. Wipe from the area where few organisms are present to the area where more organisms are present. This to limit the spread of infection. Assist the client to a supine or sitting position to provide easy access to axilla. Move clothing away from shoulder and arm. This to expose axilla for correct thermometer bulb placement. Be sure that the client's axilla is dry. If it is moist, pat it dry gently before inserting the thermometer. Moisture will alter the reading. Under the condition moistening, temperature is generally measured lower than the real. Press the button to turn on the digital thermometer. Wait until the display indicates that it is ready. Insert the bulb of the thermometer under the arm, fully into the armpit so that it is in contact with the skin. Make sure it is not contact with the clothing. Keep the arm flex across the chest, close to the side of the body. Close contact of the bulb of the thermometer with the superficial blood vessels in the axilla ensures a more accurate temperature registration. Remain still and wait for the thermometer's beep to signal that it is finished. After the beep, promptly remove the thermometer. This to get the right or proper result as the equipment thermo evaluates the heat it detects. Wipe the thermometer from the stem to bulb with alcohol. This to prevent the spread of infection. Explain the result and instruct her if she has fever or hypothermia. This to share her data and provide care needed immediately. Wash your hands to prevent the spread of infection. Record the client's result. Documentation provides ongoing data collection. Wash your hands. Hand washing prevents the spread of infection. Explain the procedure and purpose to the client. Provide information fosters cooperation and understanding. Assist the client in assuming a supine or sitting position. This to provide easy access to pulse sites. If supine, place client's forearm straight alongside body with extended straight or upper abdomen with extended straight. Relaxed position of forearm and slight flexion of wrist promotes exposure of artery to palpation without restriction. Count and examine the pulse. Place the tips of your index and third finger over the client's radial artery on the inside of the wrist on the thumb side. The fingertips are sensitive and better able to feel the pulse. Do not use your thumb because it has a strong pulse of its own. Apply only enough pressure to radial pulse. Moderate pressure facilitates palpations of the pulsations. Too much pressure obliterates the pulse, whereas the pulse is imperceptible with too little pressure. Using watch, count the pulse beat for a full minute. Counting a full minute permits a more accurate reading. Record your rate on the client's chart. Documentation provides ongoing data collection. Wash your hands. Hand washing prevents the spread of infection. Make the client's position comfortable, preferably sitting or lying with the head of the elevated 45 to 60 degrees. To ensure clear view of the chest wall and abdominal movements. If necessary, move the bed linens. Prepare count respirations by keeping your fingertips on the client's pulse. A client who knows our counting respiration may not breathe naturally. Observe the rise and fall of the client's chest, one inspiration and one expiration. Male nurses should observe the rise and fall of the abdomen. One full cycle consists of an inspiration and expiration. Count respirations for 1 full minute. Allow sufficient time to assess respirations, especially when the rate is with an irregular. Allow sufficient time to assess respirations, especially when the rate is irregular. Perform hand hygiene to prevent the spread of infection. Wash your hands. Hand washing prevents the spread of infection. Gather all equipment. Organization facilitates performance of the skill. Cleanse the stethoscope, earpiece, and diaphragm with a spirit swab wipe. Cleansing the stethoscope prevents the spread of infection. Have the client rest at least 5 minutes before measurement. Allow the client to relax and help to avoid falsely elevate readings. Assist the client to a comfortable position. Be sure room is warm, quiet, and relaxing. The client's perception that the physical or interpersonal environment is stressful affects the blood pressure measurement. Remove any constrictive clothing. Not constricted by clothing is allowed to access the brachial pulse easily and measured accurately. Center the cuff's bladder approximately 2.5 cm or 1 inch above the site where you palpated the brachial pulse. Center the bladder to ensure even cuff inflation over the brachial artery. Wrap the cuff snugly around the client's arm and secure the end approximately. Loose-fitting cuff causes false high readings. Appropriate way to wrap is that you can put only 2 fingers between the arm and cuff. Palpate brachial pulse distal to the cuff with fingertips of non-dominant hand. Close the screw clamp on the bulb. Inflate the cuff while still checking the pulse with other hand. Observe the point where pulse is no longer palpable. Inflate cuff to pressure 20 to 30 mm mercury above point at which pulse disappears. Maximal inflation point for accurate reading can be determined by palpation. Open the screw clamp, deflate the cuff fully and wait 30 seconds. Short interval eases any venous congestion that may have occurred. Position the stethoscope's earpiece comfortably in your ears. Turn tips slightly forward. Be sure sounds are clear, not muffled. Each earpiece should follow angle of ear canal to facilitate hearing. Place the diaphragm over the client's brachial artery. Proper stethoscope placement ensures optimal sound reception. Stethoscope improperly positioned sounds that often result in false low systolic and high diastolic readings. Close the screw clamp on the bulb and inflate the cuff to a pressure 30 mm mercury above the point where the pulse had disappeared. Ensure that the systolic reading is not underestimated. Open the clamp and allow the aneurodial to fall at rate of 2 to 3 mm mercury per second. If deflation occurs too rapidly, reading may be inaccurate. Note the point of the dial when the first clear sound is heard. The sound will slowly increase in intensity. The first sound heard represents the systolic pressure or the point where the heart is able to force blood into the brachial artery. Continue deflating the cuff and note the point where the sound disappears. Listen to 10 to 20 mm mercury after the last sound. This is the adult diastolic pressure. It represents the pressure that the artery walls exert on the blood at rest. Release any remaining air quickly in the cuff and remove it. Continuous cuff inflation causes arterial occlusions, resulting in numbness and tingling of the client's arm. If you must recheck the reading for any reason, allow a 1-minute interval before taking blood pressure again. The interval eases any venous congestion and provides for an accurate reading when repeat the measurement. Assist the client to a comfortable position. Advise the client of the reading. Indicate your interest in the client's well-being and allow her to participate in care. Wash your hands. Hand washing prevents the spread of infection. Return the instruments to proper place and discard. This to prepare for the next procedure.